For us at Potoko, the Center for Pacific and Global Health, we were involved in co-writing a report with colleagues and friends from Tonga, from the Marshall Islands and Vanuatu. I suppose a group from the Pacific to try to highlight the issues of the Pacific region. The project itself is global and facilitated by the Center for Asia-Pacific Resilience and Innovation. And I suppose the motivation is to try to highlight the challenges of health systems in the islands, small, not well funded, always struggling with finding and keeping enough health workers, securing sufficient medicines that we know works for common conditions like diabetes and heart disease. So the headline is Malcolm Turnbull. Malcolm was Prime Minister of Australia, and one of his roles now is the head of the International Advisory Board for the Centre at Capri. And we're also fortunate to have Shirley Lin, who's the founder and head of Capri, the centre in Taiwan, and some of her colleagues and board members, because the Pacific component is part of a global effort. So they've done reports on the Philippines and Malaysia, Singapore and so on. So the Pacific Islands report is part of that. And obviously the Honourable Siale Akawala from Tonga, Emi Chotaro, the Chief Executive Director of PIHO, the Health Association from the North Pacific, and Basil Ladoro, who's the Chief Surgeon, but he's also the Executive Director and Head of Helper, a boat, a mobile boat that goes around Vanuatu and available post-disaster for surgical, medical and health services. We also have Ashley, the chair of our board at Potoko, and he'll do a summary at the end. I've also invited a person, Dr. Eileen Natuzi from Georgetown University. Yes, I mean the Pacific Islands, as we all know, is disproportionately affected by climate change, and particularly healthcare facilities and health in general. So part of the motivation for highlighting this, of course, is we have a global audience who might be interested in the specific issues of affecting the small island states.